Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. David Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new TEAM therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. David is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda.
Hello, David. Oh, I don't know why we're laughing, because we're about to listen to a podcast that's a little sad, but has a very happy ending. So that's where the laughter comes in.
Cool. And by the way, I stopped doing the weird hello Rhondas a couple of months ago because we got an email from a fellow. I don't have it in front of me, but he's from Guatemala. And I thought he was emailing saying he was getting so sick of the weird hello Rhondas, so I got all ashamed and we've stopped doing that.
Right.
And I just got an email from him about 2 days ago saying, what happened to the cool hello Rhondas that he meant to tell us that he loved him and don't stop doing that.
Oh.
And that the weirder they got, the more he liked it. And he said this gives us a human, relaxed aspect to the show. So
okay, cool.
We're bringing it back, Rhonda.
Okay, listeners, wait, this is podcast 181.
And we're going to be real brief, and then you're going to hear some live work. The title of this is going to be High Anxiety, Shrinks Are Human Too. And this was live work that we did with a therapist named Sarah, who started having panic attacks actually during therapy sessions, and we're very indebted to her for allowing us to play this podcast. People have said that the live work is some of the most interesting and powerful podcasts from human interest point of view and from a training point of view, and to do more. And so we're actually going to be doing more live work. As you know, when I do live work, I try to complete a course of psychotherapy in one session. So it's generally a 2-hour session. And in the past, we've broken them into little pieces with commentary. And this, some people said they'd like us to play it all through, one solid 2-hour podcast, just hearing the whole therapy from start to finish with no commentary. And so that's what we're gonna do. And if you only have like an hour to listen to the podcast, you can split it into two parts and listen to the second half at your convenience. If you stop after, we'll go testing, empathy, A equals assessment of resistance, M equals method. So if you were to stop after the empathy phase or after the assessment of resistance phase, and then you can hear the end of it when you come back to it. One other point I wanted to make is that this podcast will illustrate this hidden emotion technique that I developed. It's one of 4 powerful treatment models in the treatment of all anxiety disorders. And what the essence of it is that, and most therapists actually miss this, overlook this, but when someone is very anxious, often it's because they're exceptionally nice, too nice, really. And there's something bothering them that they're not bringing to conscious awareness. And so you can work with them on their distorted thoughts or challenging their negative thoughts or using exposure techniques. But if this hidden emotion phenomenon is going on, as it is in more than 50% of anxious patients, you won't get complete recovery unless you include the hidden emotion model. And so this will be a really powerful example of that. And at the beginning of the podcast, you'll hear just how easy it would be for any therapist not to notice that there's something in the background that needs to be addressed.
So you're saying bringing the hidden emotion to conscious awareness, and then it can be addressed.
Yes, there are two things that have to happen. Just to put it, the hidden emotion model in the simplistic form. Let's say that you're mad at somebody. Let's say I'm mad at Rhonda, but then I'm telling myself I'm not supposed to be mad at Rhonda. I'm supposed to be Dr. Feelgood. And so if I get angry, then I might kind of like sweep it under the rug. But I'll be getting anxious. I'll feel very uncomfortable because there's something bothering me. But if you were to ask me, David, is something wrong? I say, no, not everything's fine. I feel like horrible, like a sense of impending doom, and I'm really anxious and feel kind of downtrodden and really upset, but just help me with my negative thoughts. And then I might be having panic attacks or generalized worrying or a phobia, or it can come out as any form of anxiety, and helping the person figure out what the problem is that they're not dealing with, that they're avoiding, and bring it to conscious awareness. That's part one of the hidden emotion technique. And part two of the hidden emotion technique is encouraging the patient to express those feelings or solve the problem that they've been avoiding. And it's one of the most powerful techniques I've ever developed. It's kind of stole it from Freud, I would say. He talked about suppressed, repressed feelings. And this is kind of a simplistic version of psychoanalysis. Instead of being on the couch for 5 years, you just tell the patient, I know you're suppressing something. I demand that you tell me what it is right now. And you say, well, could it be this? Are you upset with your spouse or your work? Or is there something, that you're not dealing with that's important to you? So that's about it. And
but I think this episode also illustrates something that you really emphasize, is that therapists need to heal themselves before they can heal their patients.
Exactly, and that's why this is such an important part of the training we do at Stanford and in my workshops. I know you've done personal work on a couple of occasions, and I've had to do my own personal work for all of my 17 anxiety disorders that I've struggled with at one point or another during my life. And when you do your personal work and have a profound transformation kind of experience, you have so much more to bring to your clients. It makes you happier, of course, if the personal work is effective, but it also makes you more effective for your clients. And there's one other thing I forgot to mention. Since we won't talk to you at the end of the podcast, you're just going to listen to this fairly amazing session, I would say, with Sarah. Is that on the 17th of May, I've got an upcoming one-day workshop with Jill on the cognitive distortion starter kit. And so it's probably going to be a really fun experience, and show you how to best techniques for each of the 10 distortions. That's May 17th. And you can get the registration information on my website, feelinggood.com. And one last thing, the therapists for this live session with Sarah are brilliant and beautiful Rhonda, a fantastic colleague, Kevin Cornelius, who's working at the Feeling Good Institute, and he's in the low fee clinic just because he's got to get his certification hours, but he's fantastic. So if you need a great therapist, think of Kevin Cornelius. It's only $95 an hour, which may seem like a lot, but it's cheap by California standards.
Right.
And he's both compassionate and a very clever and wise team therapist.
And you, of course.
Oh, and me, yeah.
The amazing Dr. David Burns.
Yeah, thank you. And so, anything else?
I think that's it. Let's just invite people to listen.
Yeah, and hope you enjoy it. And thanks again to Sarah for your courage and generosity of sharing something so intensely personal with all of us. And what is today's date? December 3rd, 2019. And we're here. Want to use your normal first name?
Okay.
Sarah. You won't use your last name. and who has courageously agreed to, as part of professional training, to be the patient in this demonstration tonight. And Rhonda Borowski is my podcast host, is going to be co-therapist, as is the wonderful Kevin Cornelius, who's a fabulous therapist and a member of our Tuesday group as well. And then we've got another 2, 4, 6 people from the Tuesday group here. And so we have 10 people in the seminar room. This is one of 4 live therapy groups that's happening tonight. And you all want to, well, I guess I won't ask you to introduce yourself, because we can't easily pass the microphone around. But we've got Estelle, Esther, Rose, Zaina, Karen, And is it Ravit? And Ravit. So thank you, Sarah. And I'm just going to quickly go over your scores in the daily mood log, and then we'll talk and see what's up. Your depression score on the brief mood survey, how you're feeling right now, is 6 out of 20, which isn't especially high. But 4 of the 5 depression items have some symptoms, and the strongest one is feeling a lot of discouragement or hopelessness. There's no suicidal urges. The anxiety is high in the low severe range, 14 out of 20, and you're feeling a lot of anxiety and worrying and tense and nervous and feeling moderately frightened right now. And then anger is 5 out of 20, and that's kind of a low anger score, but it's significant because 5 is quite a bit of frustration and annoyance and anger. Those are moderately strong feelings. And then the happiness is not high. The happiness you want to be high, and on 0 to 20, it's only 13. And the only thing that's in the highest category is feeling motivated and productive. You feel a lot of that, but you're only moderately happy and only moderately feeling worthwhile, and only a moderate pleasure and satisfaction in life. And you feel a lot of happiness and joy, but not an extreme amount. So there's room for improvement there. And then finally, relationship is
That's my husband.
A husband, Mike, is 25 out of out of 30. Let's see, 1, 2, 3, 4, 5. Let's see, 4 times 3 is 12, and 5. This is actually 17, I think. Let's see. No, 16 and 5 is 21. 21 out of
You're
30.
Right. Thank you.
So there's quite a bit of room for improvement there in the relationship. The overall satisfaction is moderately. All the others are just somewhat satisfied, and nothing is very satisfied. And you've actually you've done quite a bit of homework on this issue, and then you say that the thing that you want help with is okay. Or do you want to read this, or do you want?
Go ahead.
Okay, is the in a session today, you had an experience of feeling panicky while treating a patient. And I feel like I want to escape, and I feel out of control. And I can imagine that's kind of doubly a problem for you because you're supposed to be an expert, and
That's
yet
right.
you're feeling anxiety while treating someone. How many of you have sometimes felt anxiety while treating someone? So that's just pretty much everybody.
Also, I primarily specialize in helping people with anxiety.
Yeah,
and
okay.
panic.
Yeah, well, that's why I love treating anxiety. I've had 17 anxiety disorders myself, so
Same.
I'm very comfortable treating anxiety. And but I can imagine that puts you under a little extra pressure too.
Yes.
Like, and they used to joke around, say, if you go to a workshop, you can always tell what the person is specializing in by what their thing is. Like, I went to this workshop, this expert on narcissism, and he was practically wearing a tuxedo, and he came in a Rolls Royce. But at any rate, all kidding aside, your sadness and feeling sad, blue, down, and unhappy, 80 out of 100, and that's very high. That's a lot of strong unhappiness right now, and the anxiety, panic, and nervousness is 90 out of 100. So that's up in the extreme level. And you feel 90% ashamed, which again is very strong, and you feel 90% inadequate, defective, and incompetent. 70% alone, 90% self-conscious, 100 discouraged, 100 frustrated, stuck, and defeated, just extreme in those areas, and then a lot of anger too, irritation and upset, 80 out of 100. And then you had some thoughts here, and tell me the percent belief in each, because
Okay.
we didn't record those, and that'd be useful. The first negative thought is, I need this to stop. And what's the belief in that one?
Like 85.
85. I can't manage this on a regular basis.
85.
85. And these are painful for you, aren't they? Yeah, I can see that you're feeling shaky right now. I know what's happening. It's my thoughts. Yet I still can't get a hold of myself, and that's actually. Can I reword that as a should statement? I should be able. Yeah. I should be able to get a hold of myself. And what's the belief in that one? 100. And I need better control of my body. I'm too sensitive. It's 100.
Yeah, I would say it's 100.
100. And rather than reading the rest of these, why don't you just kind of...
It's okay. I'm doing okay. It's up to you.
Okay. The tears are good, actually. And who has some tissue? I always end up short of tissue.
That's all right.
It's clean.
Are you sure?
We have a germ phobia also.
A little bit of that. I was going to add that. Oh, actually, are you sure? Okay. Using clean tissue on my eyes, close to my face.
Yeah.
Okay.
When you were feeling tearful and shaky just now, what thought was crossing your mind, and what were you thinking about? Were you picturing anything?
I think primarily that I've dealt with some form of anxiety, panic attacks, really badly in my 20s. It's gotten a lot better in the last several years. And I've just had a resurgence of struggling with it, and I'm just exhausted from it. And I'm also frustrated because I feel like I'm understanding it better than ever, yet still entangled up in this discomfort or suffering that comes on, and sort of tangled up in this, what feels like a very big need to control, And I think that at the same time, I understand how that's part of the problem. And so I end up spinning around in my head.
Yeah.
And I'm trying to reframe the thoughts. And sometimes I just go in this spiral, and then I watch myself causing the physical symptoms.
Sure. I'm so glad that you said that, because that happens to everybody, and the attempt to understand and control symptoms typically makes it worse. And if we are so fortunate as to turn this into a podcast, a lot of 60% of our podcasts are people looking for help with personal problems. The other percent are therapists looking for help with personal problems. And so all the listeners can strongly identify with what you just said, and you get trapped, and it seems impossible to get out of the trap.
And I want so much to, I love what I do, and I'm in a place now in my career where I've always wanted to be, and I want to get up and just be really excited to get to my new awesome office where I have all these patients, and I'm getting new inquiries all the time from word of mouth and other people's positive experiences of my work. And lately I feel like I'm suffering more than the people that I'm helping. I just so much want to go and be excited every day.
Yeah.
But now I'm like having this, it's almost like, it's like the panic about the panic. It's almost like I had it once happen recently, and now it's like a traumatic experience. I'm remembering it.
So it seems like there's a couple of things that make the symptoms even worse. One, I'm supposed to be an expert.
Right.
And the other, I'm supposed to be at the peak of my career. I've got a beautiful new office, and
a
People,
thriving practice.
thriving practice. People love me. I'm getting a lot of referrals, and I want to be excited, and yet I'm feeling straddled with all these intense negative negative emotions, and just must be very sad for you. How long? And I feel sad for you too. How long have you been struggling like this for this current upsurge?
Yeah, this recent upsurge. I think I just went into private practice on my own. My own business for the first time this past May. I've been doing therapy for 13 years, and I definitely think my anxiety increased, which I think is understandable. Starting a new business and going out on my own and wondering if it would be successful, and all of that made sense to me. But I think just in the last couple of months is when it has become more difficult for me, like I said, to feel peaceful about going into the office. Just wondering, is today going to be a day where I struggle with my body in one of my sessions?
Wow. So it sounds like for the last couple of months, it's pretty much 24 hours a day been bothering you, and particularly before you go into work and when you're at work.
At least, yeah, I would say maybe it's gotten worse, especially in the last couple weeks.
Oh,
it's been moderate the last few months, but the last few weeks where it's been every day has been more of a struggle to just sort of start my day feeling peaceful or calm.
How old are you?
I'm 44.
You're married, are you?
I'm married. I have 2 little girls. One's turning 7 this week on Thursday, and the other one is 4 1/4.
Oh, okay, that's beautiful. Two girls, 4 and 7. How are they doing?
They're amazing.
Are they?
My 4-year-old has an intense side.
Intense. Oh, okay.
Similar to my own.
Okay.
There's been some challenge, around
that.
That, I think.
What would be
which has gotten better since she turned 4, but the 2s and 3s were very stressful.
In what way?
She didn't really like shoes or clothes or jackets. So every morning was an intense struggle to get out of the house, and very hard to get to places on time in a peaceful, calm manner.
Oh.
And that is mostly on my shoulders, the morning routine.
And you say it's on my shoulders. Does that mean that you would like husband to be chipping in more?
He is a wonderful person and father. He is not a morning person. He mostly takes care of getting himself ready, and then takes our older child to get to school on time, which is of course helpful. And then I manage, the second half of the morning routine, which is getting the 4-year-old ready, myself ready, and then to her school. But I do have funny you brought this up, some resentment around that.
Yeah. Elderly shrinks sometimes can come up with stuff.
Yeah.
What's that ad on TV? Some insurance. We know a thing or two because we've seen a thing or two.
Right. Yeah.
They put you under a lot of pressure.
That's right.
And
it's also where I feel like I can't really start. Like I don't usually schedule anyone until 10:30.
Yeah.
Because it takes that long. The breakfast, and then there's making the lunches, and then getting everybody dressed, and their hair, they both have long hair, and getting it done just right. And I have long hair, and getting myself together and presentable, and then getting the child to agree to go to school.
And then you get into work at 10, did you say? Or?
Yeah, I usually don't see anybody before 10:30.
10:30, and then you work until when?
I usually have to leave. This is my one night in which my husband does the pickups and
Mhm.
takes care of the girls so
Oh,
that I
yeah.
can come to this group. Otherwise, I do all of the pickups and the dance lessons and the driving from here to there. And um, if if school is closed or there's a holiday or an early dismissal, I manage those details. So most days I have to leave by 4, 4:30, and sometimes 3:30, depending on what their after school activities are.
Yeah. And then how long does that take? Until 10 p.m. or?
Just all of the evening routine. Yeah, I
Yeah.
think I run pretty consistently until we get them to bed at about 9.
Yeah.
Yeah.
So, what do you do in your free time? That was an attempt at humor.
Free time. I feel really busy all the time. I think that, now and again, if I don't have a patient till later, I might
Mm-hmm.
Exercise
Mm-hmm.
or go for a walk.
So
But that seems harder to do.
You have plenty of free time.
Free time. Yeah. It's like
20 minutes.
Weekends or
3 times a week,
Mhm.
something like that.
Yeah, I always feel like a jerk saying these kinds of things. Like the weekends, I'm not working per se, but finding time to just, I don't know, meditate, vegetate.
Yeah.
I don't know, any of those.
Yeah. And
It's not easy.
You don't have a lot of that time.
No, and I really devote a lot of energy and love, obviously to my little girls who are worth it.
Mm-hmm. Well, I don't want to jump ahead of us. We haven't
Yeah.
even gone through here, but Beck used to have this expression of a give-get imbalance sometimes that people would get into when you're giving, and
it's tiring.
Yeah. Do you think that's part of what's going on behind the scenes?
I do.
Yeah.
I definitely think that's part of the equation. I think, one thing that's been on my mind recently is how at 4 and 7, there's actually a slight reduction in the amount of attentiveness required.
Oh.
I've just been noticing that, like, oh, I could leave them both downstairs and possibly no one will get injured.
Yeah.
Right? And so somehow, and I look back and I think, how did I get through the last 7 years, between the breastfeeding and all, when they're a baby and you're monitoring every little second. And I didn't have this happening. I was like, go, 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 and super rocket lady. And I didn't have panic during those years or when I was pregnant. I always worried about being pregnant before being pregnant, thinking, oh, I'll freak out. I'll want to take it out temporarily and put it back in.
Right.
And that never happened.
Right.
But it's been happening lately now that they're more stable.
And is it also true that you weren't feeling resentful then, but you are now?
I think there's different forms and layers of resentment that have come and gone, but definitely peaking in the resentment around.
And peaking in the anxiety.
That's right. And how much I'm holding on to.
And you're an exceptionally nice person, right?
It's true.
Yeah.
It's very true.
So just for people who don't understand, probably most listeners do, probably most people in the room do, I'm just getting at the hidden emotion model, which is one of 4 ways of understanding anxiety. But you always have to keep a suspicion on it. And just as a teaching point, it's important because you don't hear that from most cognitive and behavioral therapists. They're all into techniques to help the symptoms. But if there's a background issue of feeling kind of upset about something and not having the permission to express those feelings or to deal with the resentment, then it gets converted into anxiety or panic, and it's impossible to get a complete cure without taking this into account if that hidden emotion phenomenon is going on. And in anxiety, people who are experiencing anxiety, it is going on a good 70% of the time, I would say, at least. But you usually can't get it as quick as this. And there may be more than this too that will come out. But most patients who are anxious will tell you, I love everyone, everything's fine, just help me with my panic attacks or by phobia or by this or by that. But most of the time there is something going on, behind the curtains.
Yeah. I feel like I should say, or I would like to say, to be fair, I do have a side in which I can be very expressive of my irritability to my husband. And it also occurs to me that I have repeated my frustration with particularly the morning routine at least 182 times. At least.
You know what the Buddha said?
What?
183 is a charm.
Oh, okay. I'll have to work on that. Using the 5 secrets somehow.
So you've expressed your morning irritation 182 times and nothing's changing.
Right.
And you think that's an important, at least partial key to?
I think it could be part of it.
To me, it's just, I've said this over and over in the group, but I'm all for women and for powerful women. Most of the leaders of this group are powerful women like Rhonda and Jill and Helen and so many that we have. But the downside of all of that is that it seems like women have taken on increased responsibilities. So now, the slavery is increasing actually, because you're supposed to be a full-time wife, a full-time mother, working full-time, and just giving, and on this kind of endless treadmill, and it doesn't seem right. And even looking back on my own marriage, my own family, and my wife went to college after we already had our kids, and then she got her PhD, doing all of this while raising the kids. At the time, I kind of wasn't noticing. I thought, well, everything's fine, she can do all this. But then I think back on all the stuff she did, and it's like unbelievable. And I think even about Jill, I'll stop babbling, but Jill is doing so much for so many people, and I've been telling her to start saying no to stuff. And, I don't even ask her to do stuff much anymore, because she's just so giving, and you're only, alive once, to be with your family and to have some time to do the things. And so I don't know to what extent that plays a role in your symptoms, but I can certainly see it.
I think it's part of it. There's something my husband says, usually just when he's irritated with me, or issues around this come up, but he says, you only work partial time. What do you even do all day when you're not seeing your patients?
Yeah. Well, what do you do? Because it sounds like you don't have much to do. So
he doesn't understand how important it is to file my nails all day.
Yeah, do you eat chocolates too?
That's a joke. I actually do fit in chocolate.
Let me see your nails.
No, they're not.
Oh, they're beautiful. Yeah,
they're not bad.
When he says you only work part time, what do you do all day? Then how do you feel?
Actually, really terrible, and very frustrated, because, as everyone in this room knows, the face-to-face time with our patients is only a sliver of the work, and I'm very devoted, as you may have noticed, to developing my TEAM-CBT expertise and coming to this group.
Yeah.
I live in Oakland.
Oh, wow, that's a huge drive for you too.
Yeah, thank you for the extra points.
Yeah.
I'll take them.
Yeah.
And also,
that Nimitz freeway is a killer.
Yeah, It's
ugly.
terrible. It's so ugly. And just the paperwork and, new phone calls you have to return. And
Do you take insurance?
ongoing learning. Actually, don't take insurance, but,
Okay.
Generating super bills, right? And all these things. But that's just with the work part. And then, there's a lot to keep up with the kids.
If you had only one child and no job, you'd be busy 24 hours a day.
Probably.
And then you've got three children.
I have two.
No, the husband.
Oh, got it.
and then you've got your job, and it just seems almost impossible. Let me go over the
Okay.
rest of your negative
I'm
thoughts
ready.
here. That was just like a little
Yeah.
aside, but to what extent am I getting it so far?
I think you're getting that part very well.
Let's just finish up with these negative thoughts. You said, this is my specialty, and now I'm feeling like a fraud, and we're not allowed to use that language because
right.
that's a feeling. And I
am a fraud.
Now I'm a fraud. And then how believable does that one seem?
85.
85.
Mm-hmm.
And just not a full-blown fraud, just 85%.
Just an 85% fraud.
Okay. I've made so much progress over the years, but I will never really untangle it, and that's kind of the hopelessness, discouragement.
Mm-hmm.
What's the belief in that?
100.
100%. A lot of people listening, if this is a podcast, people
Mm-hmm.
listening have also had that thought.
Mm-hmm.
I'm never going to get over this, and I'm doomed, some version of that. I'll never be the courageous, stable, steady nerve person I long to be. And what's the percentage of that one?
100.
100. And my body and mind betray me every day.
Lately, 100.
100.
Mm-hmm.
And if I can't breathe right, I'll totally spin out of...
spin out at some point.
Spin out. And what's the belief there?
So this is about like when I breathe, feeling like if I can't get a deep enough breath to calm my system, and I start feeling like I'm slightly hyperventilating.
Right.
Right. So 100.
100. And what is the cause of all anxiety? The attempt to calm yourself, right?
Right.
Mm-hmm.
It's almost like an OCD thing, checking in my breathing. Am I
I
breathing?
see. Yeah.
Was that deep enough? Did I get it?
Yeah.
Did I get to the depth of my lungs?
Yeah. Right. Yeah. Because if you don't, you got all that old air down there. Who knows what
well, then it's
happen.
when and then I start with the thoughts about the ones that shoot the adrenaline through your body.
What are the thoughts?
Just about I can't breathe. That wasn't deep enough.
Yeah. I can't breathe.
If I can't breathe, I won't be able to calm this building anxiety.
And then what'll happen if I can't breathe and calm the anxiety? We can do a downward arrow here.
I'll lose it.
And then and what will it look like when I lose it? If I lose it.
I think in this context, what I'm most worried about is interrupting the session or having to, like I'm freaking out and have to end the session or scare my patient or.
And so I'll scare my patient and my patient and have to end the session.
Right.
And then and if I don't end the session, what am I afraid of? Like if I lose it, what will that look like? What will I be screaming or rolling around on the floor? Or what am I the most afraid of?
I think I've learned, because it hasn't happened yet, that I probably won't scream and roll around the floor, but it's more about having to say I can't go on.
Right, but why can't I go in? What am I afraid of? What's the worst that could happen?
Like I just can't literally put my thoughts together anymore.
And then if I can't put my thoughts together with my patient, should I be upset about that? What happened?
Right. If I can't put my thoughts together anymore, I'm incompetent as a therapist.
Yeah, but before we get to that, if I can't put my thoughts together, what does that mean? Will I start talking in tongues or?
Right, that I'm losing control of my mind.
And then how will that look to the patient? What will be happening here in the room?
Like psychotic or crazy.
Yeah, but what would that happen if I went crazy, if I got psychotic? What will that look like?
If I get crazy and psychotic.
Yeah, like tonight maybe.
Yeah.
What would happen?
Just sort of like babbling.
I'll babble?
Incoherently.
Uh-huh.
Maybe pacing and like unable to sit down.
I'll be
I don't
babbling incoherently and pacing, unable to sit down.
Maybe. Yeah, or just...
Will you be dribbling from your mouth or foaming at your mouth or something like that?
Yeah, foaming at my mouth. Having a seizure.
Yeah.
Because I can't breathe.
Yeah, we did that on the Sunday hike.
Yeah.
We were expressing anger and making the ugliest faces we could, and I made my Clint Eastwood face. And sort of make my day or something. And they said, be better if you were drooling. So I started drooling and then did it.
I bet that was attractive.
So you'll be pacing, you'll be babbling incoherently and pacing, unable to sit down and foaming at the mouth.
Or I'll just pass out.
And pass out. And then what will the patient be thinking?
Why am I engaging in therapy with this woman?
Yeah.
And paying a lot of money
so
for this service.
My patient will judge me, or
feel let down.
We'll feel let down and see that I'm incompetent.
Right.
And that's your worst fear?
I think that's one of them.
What are some others?
I think it's just about losing control of my body because it happens in other contexts.
What context do you lose control of your body?
Well, I mean, the panicky feelings when I feel sort of trapped happens in other contexts.
And then when
and that's not about my patients, in other words.
Yeah.
So that's about...
Yeah, and then what would happen if I lost control of my body, say here, tonight?
Oh, God, I knew this was coming.
Oh, did you?
I was wondering if that would be part of this. Can you ask the question again? Because
well, I was just going to say, as a preface of this, if it
Yeah.
gets real bad and you have to spit up or something, would you turn in the direction of Kevin?
no problem. Yeah.
So
We wouldn't want to ruin your
Kevin's
snazzy
used to it. He's got
exactly,
a month
exactly.
old
Just wearing a
baby.
t-shirt.
Right.
And
And the twins have already
yeah,
spit up on
exactly.
it, likely. But David's shirt,
Yeah,
very
well, this
snazzy.
Nice
maybe
fancy
I'll
shirt.
be your target. This is kind of like multicolored
Yeah.
vomitoid. Anyway.
Yeah, it would let.
But what would happen then if you lost control of your body?
I feel like I have this fear of asphyxiating, like, that's why I mentioned, or just falling over into a seizure.
I'll asphyxiate and have a seizure.
Right.
Will you pee on yourself?
Maybe.
Well, let's not take this too far.
I know.
And I on another level, like I've had this happen so many times, and I'm very cognizant that none of that has ever happened.
Well, there's always a first time.
Yeah. But I'm just so tired of the discomfort, and it's the
discomfort of worrying about this.
just the way it
Yeah.
feels in my body when I
Mhm.
feel like I can't breathe right, and
Mm-hmm.
if my heart's racing a little bit, it's like, so what? I'm
Mhm.
over that. Like if I'm talking to someone and I feel a little nervous and my palms are sweaty, it's like, whatever. It's this feeling like that I can't breathe right. That's what scares me.
Yeah.
And it's, happens on airplanes. It sometimes happens. It happens usually in settings in which I feel confined, which I know is typical. Like maybe sitting in the middle of a row at a show, like a theater or concert, or being on an airplane where I know that I can't go anywhere other than to the restroom.
Kind of a claustrophobia type of thing.
Yes, yeah.
Mhm.
And like it happened when I first moved to the Bay Area, I didn't like crossing the bridge. And then it went away because I had to cross the bridge every day.
You mean drive across
Yeah.
one of the bridges?
I'm not really scared of it falling down. I'm not really scared of a plane crashing.
Mhm.
Turbulence feels like a bumpy road. It's
Yeah.
like I'm struggling with my own experience of my body and knowing it's going to happen.
Yeah.
Like it's going to happen because it always happens.
Could you get trapped in this room? Like if we put you under here with all these chairs around you or something, would you be trapped or confined or?
I don't think that would scare me.
Yeah. What would?
Here at Stanford? You mean what would
I think
scare
that's
me?
where we are.
Yeah, like something that we could do here
Well, even in this room, not
Yeah.
just here
Yeah.
at Stanford.
in this room.
Or in this floor.
Yeah.
I don't know. I don't know that I would be scared in this setting.
Okay. That's okay.
Sorry if that's not helpful.
No, that's okay. Let's
Sure.
finish your negative
Yeah.
thoughts here.
Okay.
If any of my patients
Patients.
hear that this or find out, they will doubt me or leave. That's a good reason to have it on the podcast, right?
Yeah.
Okay, so-
Yeah, exactly. That's some of my worry about
Yeah.
having it on the podcast.
Right. And what is your fear there?
100.
100, right.
Yeah.
And then when you say I can't breathe properly, what is the belief in that one?
90.
90, yeah.
Part of me knows I'm breathing.
Right. So is there anything else you want to tell us and share with us about this? We have to move ahead. I'm
Yeah.
going kind of low on empathy, but I think it's slow, but I think it's important to see what we're dealing with. Now your arms
Yeah.
are kind of folded. Are you feeling tense or a little defiant or?
Or protective of yourself.
Maybe some of that too. I think I feel some frustration and discouraging feelings because as I've been learning all of this and doing my mood logs and participating in all this TEAM-CBT, it's given me so much hope in so
Oh,
many
yeah.
ways. But I'm still stuck feeling like it's not going to work for me.
Yeah. So are you feeling frustrated and discouraged with me right now?
No, not with you
Mhm.
personally.
How are you feeling with me personally?
Well, I like you very much, and I'm very happy to have this chance to chat with you directly.
Mm-hmm.
It's exciting for me.
Oh, okay.
And it
so
just
you-
occurred to me right now.
Okay.
Hello, David.
Yeah. Hi. Yeah.
Because I always get shy because,
Right.
I feel
Yeah.
like you're a celebrity to me. And to many.
Yeah. And
To
yeah,
all.
Yeah. And don't you forget it.
I won't. This is very exciting for me.
Well, just don't
I
blow
mean, just
it
coming
because,
every- I mentioned I love your wardrobe, right?
Yeah, yeah.
And
Yeah, I had at the live demo and the workshop in Georgia. The fellow who volunteered came up the night before the first day of the workshop and told me he was thinking about volunteering, but he was afraid that he wouldn't be good enough, or that things wouldn't change enough.
Mm-hmm.
And then the demonstration was just
Mm-hmm.
off the wall. It was just so incredible. Then he's going to come up and do a podcast because we didn't have the recording equipment. It was just unbelievable. And he more than completely smashed all of his negative
That's
thoughts and
great.
feelings. He went into a state of ecstasy, really.
Yeah, that's wonderful.
Yeah, and but he said he had never thought that was possible. He thought it was just bullshit when he'd heard me talk about that.
Mm-hmm.
But that's a part of it, to feel real discouraged, and it's
Mhm.
frustrating, and you're feeling like even now this might not work, and there's a lot of on the line for you because you're hoping so strongly in your heart that this could be taken care of and get out of this prison you're in, and
That's right.
begin to enjoy so many beautiful things that are going on in your life.
I think that I've done a lot of the work to reframe these thoughts. I haven't done it necessarily, with externalization of voices and out loud. I've done a lot of my own writing, and
Yeah.
I've done some, but so I'm doubting that it will.
Won't have the teeth. The rubber won't hit the road.
Mm-hmm.
Yeah.
I think it
sure.
helps, and it helps me day to day, and I remind myself these things. And such as all the beautiful things it says about me, and I loved learning all that about myself. But yet I'm still engaging in this like thought activating, adrenaline panicky process of control spiral.
Sure. So you're
And I don't
really
know how to
hoping,
stop
but
it.
you're feeling discouraged and fearing that this won't be powerful enough,
Maybe.
and you're someone that it won't work for.
Right, like it won't work for me because.
Yeah. Well, how am I doing in terms of understanding?
I think you're getting A+.
Okay, and why is it an A+?
Well, because you reflected back what I was saying, and you had wonderful thought and feeling, empathy, and
Well, that's good.
yeah, and you asked me how it was going and if you were getting it right,
And then we did some laughing. Was that okay?
some laughing is great. I
Yeah,
love laughing
okay.
enlightenment.
Well, why don't we see what I've been kind of hogging the show here, so why don't we see what Kevin and Rhonda have to say, and
Okay.
then we'll see if we can push ahead to some agenda setting and some methods.
Yeah.
Well, if you don't mind a little bit more empathy, is that where we are still at this point?
Yeah.
Yeah, I just want to say, I'm just sitting here listening to you talk about what this has been like for you with the number of hours that you have and all the things that you have to get done, and I'm just blown away by it. Like, I just have a lot of admiration, for you. And the question just keeps coming to my mind. It's a little bit of a weird question, but I just can't even imagine how many clients can you even see in a week?
Right.
Typically.
Yeah. I mean, not as many as I would probably like to, or at the hours I would like to, or that would suit them best. I'm not so in love with doing like 5 back to back to back, but sometimes that's what I have to do.
So I would imagine that sometimes you feel almost like an obligation to see more clients so that you could be more helpful to more of them. Is that?
Well, I definitely feel like while I'm, building my own business, that I don't want to say no to new inquiries, and I'm so grateful for them and excited about them. So I do say yes most of the time, if I can make it work. But I am pretty good about having some boundaries, I guess mostly because I have to around the time.
Sure.
But yeah, it's not always in the rhythm or on the day that would suit me or suit my schedule best.
I'm just struck by how many people are relying on you.
Right. I think that's the key. Is I do notice that more and more. I was like noticing I feel this cumulative exhaustion of the last 7 years of navigating motherhood and marriage and family, like extended family, and work. And, this idea that like I finally have a window to really build my career in the way that I've wanted to for many, many years, like through the baby making and raise early years. I sacrificed the type of work I was doing in order to keep our benefits, to have the babies, and in the early years stayed in a job that I didn't want to be in for many, many, many years. So I think just saying that now speaks to like, this is the time of my life where like I finally got here, and I just, and I feel really like great about myself in so many ways. And so I want to enjoy it, and like revel in the fact that I think successful, but I just can't enjoy it. It's so disheartening. I think also, it's like my husband works so hard to provide, and he makes more money, thank God. And I'm really grateful for him. I really love him. And he's a wonderful dad. But I don't think he gets it. I don't know how to get him to see just how much I'm going through and endure to make it all work. And I think that is part of it. And in the meantime, when I do have the time, and it is my work time, like my time to develop this portion of my identity, it just means so much to me. Like, I want to feel comfortable. I just want, like, the basics, of just feeling in my body so that I can help people in the way that, like, I know I'm capable of doing. I know I have gifts and knowledge and intelligence, and now I have, like, this TEAM-CBT stuff is, game-changing, and I'm so excited about it, and this is not a commercial.
When you were crying right now, what hit me the strongest, and I was so glad that you were letting yourself have a good cry there. You said, my husband just doesn't get it, and I know you'd circled alone 70%. Is lonely, you didn't circle lonely though.
No, I'm swarmed with people.
Yeah.
I would love more time to myself. I don't mind being alone.
Yeah, I see what you mean. But I was just wondering if that was just sounding, the anger and the resentment that felt like a bit of a key to me. Husband doesn't get it. Like, do we get it?
Yes.
Is that helpful to you?
Yeah, definitely.
Creates a little peace, and so I was wondering to what extent that might be kind of a key, because we can do some awesome positive reframing and externalization of voices, and we can smash a lot of these thoughts, but if that thing is lurking behind all of this, we need to have a way of dealing with that, or confronting that, or getting a good solution to that, as well as the distorted thoughts and the symptoms. And I was just wondering, in your mind, if you were my consultant rather than the so-called patient, then would you say, how big do you think that is with Sarah?
I definitely think it's not all of it, and I definitely think that, like, the hidden emotion and the husband stuff is definitely a part of it. I definitely think it's important. I actually am not sure if there's one specific key.
Right.
I know that I've been very consciously saying to myself, our marriage and communication could use some work, but I want to get a little bit better of a handle on myself first. So that I find myself engaging with him in dialogue sometimes and saying, this is where you do the 5 secrets, Sarah.
Yeah.
And then I say, except that I'm not going to.
That makes a whole lot of sense. I've never heard someone else. Have any of you guys ever heard of anyone who resisted using the 5 secrets?
And I know we're getting close to that time where that's like, okay, it's time. I think that our marriage has a beautiful foundation.
Sounds that way. It sounds like a great marriage.
I think we are good partners in many ways, and I think that we've put aside our connection and relationship, as many do, in these early childhood years of raising our girls. It's just been easier on some levels, right, to just say, we'll attend to it later.
Yeah.
So I know that that's part of the picture. And at the same time, I do find myself, like, when you're going to ask the question, is this something you want to work on? Part of me is going to say, not yet.
Okay, I see.
I want to feel more, sort of like more self-regulation, so that I feel like when I do engage in the 5 secrets work, that I'll really do it. But so I don't know if this is a good way to think about it or not.
I have no idea, but you want to tune up in this area first, and then that would be,
I guess so.
part 2.
It's hard for me to be my best self with this going on every day, I'm just trying to keep my shit together each day.
You're feeling kind of exhausted and low on fuel.
Mm-hmm.
And the 5 Secrets takes a lot of fuel and determination.
Yeah.
A lot of more upset, and it's very, very challenging. You know, we had a fellow on the hike who needed to use the 5 Secrets with his baby mama. And after 4 years of hiking, he finally decided to try the 5 Secrets. He strenuously resisted every Sunday for 4 years. It's just interesting how hard it is, even for trained experts and highly intelligent people. There's many parts of us that just don't want to use the 5 Secrets, and we kind of cling to a conflicted situation, and yet there's a very loving basis of it.
Mm-hmm.
But that's for another day. It's so mysterious how human beings really prefer not to use techniques that lead to more loving relationships, and we have a zillion excuses and reasons.
Oh yeah, I've been using a lot of them.
Yeah.
Maybe 2020 though.
Yeah. Well, how are we doing now, would you say?
We're doing good.
Okay.
Yeah.
Now, let's issue an invitation step here. You want to do that, Rhonda?
Sure. So, Sarah, we've talked about a lot of stuff. We've talked about issues with your husband, which you've clearly told us that you don't want to work on now because you want to feel more centered. And you've talked about the anxiety that you felt, and with your patients and how you feel. We did the downward arrow, talking about your fears of, ultimately getting to a place where you have a seizure, and a lot of negative thoughts and these really challenging feelings about not being good enough, basically, in that realm, and not being able to manage. And I'm wondering if this might be a good time to, really roll up our sleeves and get to work on that, or if there's other stuff that you haven't told us that you want to work on, or maybe, just telling us is enough, or you might need a little bit more support. And what do you think?
Thank you for asking. I feel like everybody understands. I feel supported and understood and accurately empathized with. I do feel ready to roll up my sleeves. I'm having some curiosity about if it's not a good call to reject the work on with my husband.
I have that concern too, and in general the answer is no, that would be a definite bad call, because if the hidden emotion phenomena is going on, it'll be impossible to make great progress with the anxiety until it's dealt with and brought out into the open. We would make like partial improvement, like a 50% improvement, but we wouldn't get 100%. But that's just my experience. And if you have a strong idea to do this stuff first, I would be okay with that too, because we can do some awesome stuff with this.
I guess what was occurring to me as she was issuing the invitation and as I was rejecting, it was like I just said, I've maybe reframed these thoughts several times, and I find it really interesting that when I first started talking, you asked me about my role, my roles, like as wife and mother, and my non-work identity right away. So I'm now thinking I would like to trust in what you think would be the next best step.
We could also make it a 2-part thing too. Like, we could be doing like the relationship stuff tonight, and then we could pick this up later on. But it just seems to me from a human, we can knock this stuff out of the park really easy.
What?
Yeah, actually.
Are you sure?
Yeah, you're not a robot. And when your heart doesn't feel fulfilled, and when you feel kind of angry and overwhelmed by not getting a good deal in life, and even more so when people aren't listening, your husband and supporting you, it seems like abnormal to think now we can make you feel real happy without addressing that. And
that's a good point.
And the prognosis is really good because you love your husband, and So anyway, that'd be my vote. Why don't you hand
Okay.
the microphone to Esther there, and let's see what Esther thinks. What do you think, by the way?
I think that was a brilliant refocus of the agenda.
Yeah, and you brought that about too.
Really?
That's what she said. That's what you said.
But does Sarah's husband have to understand and demonstrate empathy? Or does Sarah just need to understand her husband and that he probably never will? Because men often don't.
Men are
And
very limited. There was actually an article on that in Cosmopolitan magazine.
yeah, we know
I read
that.
that.
And they don't have quite the same burdens because motherhood comes with such expectations that probably add to weighing you down enormously because you want to be the greatest mother. And somehow fatherhood doesn't seem to come with the same burdens. And he may never quite get that. It seems it would be important for you to be okay if he never gets it.
Can I speak to that?
No, you're not allowed to. It's the therapist, the only ones who talk in team therapy.
I agree with a lot of what you're saying, and I've done, I think, some personal work around that, and I think it varies day to day, right? Like some days I'm very accepting and roll with it, and, maybe he's limited in this way, or I think the part of it that fires me up is around feeling like devalued, like when he says things like, "What do you even do?"
Yeah,
while I'm working
exactly.
late.
Exactly, and if we're going to work on that, we're going to have to start now and
Yep.
Well, maybe we could do a
general
relationship
dialogue.
journal. Should we do a relationship journal?
We could actually, yeah.
Or just not feeling appreciated.
Yeah.
Some of that goes back to my childhood, but that might be for another day.
But one of the nice things about team is let's get to work, and
Let's get to work.
on a fractal, and the entire relationship problem will be revealed in any brief exchange between you and your husband, and all the solutions are there as well. And sometimes as therapists, we want to just kind of generally talk about things, and that process will typically go on and on without funneling in on something that really feels like a solution. So do you want to just take
Sure.
a quick look at an interaction with your husband, and if you folks have relationship journals, pull one out from, I think you probably bring your forms along
Yeah,
to
that's an
the
old version.
to the Tuesday nights. I have a couple extra if someone needs one. But why don't we take a look just to do you have one? Kevin? Do you have one?
I don't, but I can just use a blank one.
Okay, great. You can have this one, Rhonda, and you can share with anyone who wants it. Now let's just take a look at when your husband says that he says to you. I'm trying to find it where it's written down, but like.
What do you even do all day?
Yeah.
What do we even do? Yeah.
What do you do all day when you're not seeing patients?
You only work part-time. What do you do all day?
What do you even do all day?
Yeah, you work part-time. You work part-time.
You only work part-time. It says to write down.
Oh yeah, that's right. You only work part-time.
Yeah, I got to follow the directions.
What do you even do all day? And then what exactly did you say next, or what type of thing might you typically say next?
You have no idea.
Right.
All that I manage as well as all that I take on emotionally.
Mm-hmm.
I don't know.
So you have no idea about all that I manage as well as all that I take on emotionally.
Every second of the day, somebody needs me.
Yeah, I love that. Every second of the day, somebody needs me. Great. Now, let me just ask you a question. All I would have to offer you, or all of us tonight, would be just focusing on this one brief interaction. Would that be sufficient?
That would be sufficient.
Okay. And now a second thing is that you see here that the problem that we're trying to understand is why does husband not understand me? Right? Like what Esther said, why are men so low on understanding? And there's one of two possible answers to that. Men are genetically flawed, and we know that's, true. And the other possibility is women force men to be like that, and vice versa. And when we do the interpersonal model, we're kind of going to be focusing on your role in this. And I don't know if you'd be open to that.
I'm ready.
Are you ready?
For the first time.
Okay. And why are you ready?
At least right now.
Yeah, but why are you ready?
Because it's giving me some hope, and I know I have a role.
Yeah, isn't that awesome? But you're about to die, you know that.
Awesome.
Okay, good.
Can't wait.
Good. Yeah. Now, what emotions do you feel he was having when he said that? Let's say them out loud so we can all circle them. Is he feeling unhappy?
Unhappy. Nervous.
Yeah, nervous. That's
worried.
Yeah, worried.
Anxious. I said anxious, worried, and nervous.
Oh, anxious. Yeah, there's a good one. Yep. What else?
Discouraged.
Discouraged. Yep. Yeah. Now, is he feeling lonely, unloved, unwanted, rejected, alone, abandoned?
He perhaps could be feeling unwanted.
Yeah.
And rejected.
Yeah. That's
unloved.
Yeah, right. I suspect. And is he feeling frustrated? Stuck?
Yes, frustrated, defeated, angry, mad, resentful, annoyed, irritated, upset.
Right. Any other feelings?
I think overwhelmed.
Yeah, he's feeling overwhelmed. Is he feeling hurt?
I think he is feeling hurt.
Hurt. Any other feelings that he might be having, Kevin?
Did you call me Kevin? Did you say
No,
Kevin?
No, I called you Rhonda.
I'll take it.
I was wondering if Kevin
had any other?
Yeah, I don't know. The resentment part just stands out to me, but you already circled that.
Yeah,
so.
yeah, okay.
But do you think he could be feeling guilty, or?
I guess we have unloved. Could he be feeling unappreciated, or?
I think is unappreciated, definitely.
Unappreciated.
Yeah. When I circle the words anxious and worried and nervous, I think that two things come up. It's one, it's hard for him to see me. He does see me as strong.
Yeah.
And independent, and so when he sees me struggling, I think it makes him nervous.
Yeah, that's great.
Because could he be scared too?
Scared, and I think it's really, he has his own business, and he is the primary provider, and so I think some of that anxiety is about.
Yeah, that's awesome.
And also wanting to feel appreciated for all that.
Yeah, I love that. Now, what were the feelings you were having when he said that? Oh
boy, you have no idea all that I manage, as well as all that I take on emotionally. Every second of the day, somebody needs me. Sad, unhappy, anxious, worried, panicky, nervous, inadequate, incompetent, inferior, worthless, defective, lonely, unloved, unwanted, rejected, alone and abandoned.
This is a handy little forum, I'll
It
tell you.
really
Yeah, yeah. I'm glad there are no hidden emotions.
Humiliated,
Yeah.
self-conscious,
Uh-huh.
hopeless, discouraged,
Mm-hmm.
pessimistic,
Mm-hmm.
despairing,
Mm-hmm.
frustrated,
Mm-hmm.
stuck,
Mm-hmm.
thwarted and defeated,
Mm-hmm. And with
and
just
definitely all
the
of
whole
these.
the whole column
Angry,
of
mad,
anger.
resentful,
Yeah.
annoyed,
Yeah.
irritated, and definitely furious.
And then how about hurt,
And very hurt,
overwhelmed,
overwhelmed,
unappreciated?
unappreciated.
Okay, that's awesome. Now,
Okay.
take a deep breath.
Goodbye, ego.
Yeah. Fasten seatbelt. Okay, great. Now, was my response a good communication or bad communication? EAR, empathy, assertiveness, and respect. Now, empathy, did you acknowledge his feelings and find some truth in what he said? Or did you ignore his feelings?
I ignored his feelings and insisted he's wrong.
Yeah.
For sure.
Yeah, right. So that's bad communication. Assertiveness, did I express my feelings openly and directly?
No, I was definitely aggressive.
Yeah.
I mean,
yeah.
I think that I expressed feelings, but in an aggressive way.
Well, which touched the feelings that you shared. You said, I feel sad.
Oh, you want me to say them?
Well, just, yeah, I mean, you said you expressed your feelings. Did you say that you felt sad?
Oh, no.
Did you say you felt unhappy?
No.
Worried?
No.
Panicky?
No.
Would it be fair to say that there are 20 feelings here that you didn't express?
Yeah.
Okay, so we'll call that then, for assertiveness, for I feel statements, we'll
Yeah,
call that
bad.
bad communication. And then would you say that you conveyed love or respect?
No.
Okay. Now, before we go on to the really heavy hitting step 4, just looking at step 3, is that easy for you to see, or hard or painful, or?
I think that it's not easy, and I've also known for quite some time.
And tell me in what sense it's not easy.
It's not easy to admit that it's not all him, and that I have a significant role in being in him saying those kinds of things to me.
Yeah, it sucks, doesn't it?
It sucks.
Yeah,
totally
I hate
sucks.
it. When I have to do this myself.
Yeah,
it hurts,
it hurts
a lot. And now for the big one, what will be the consequences of responding to him this way? How will he feel? What will he conclude? And how will he behave? What will happen?
It's going to make the problem worse, and he's going to
put that down. Make it worse because why?
Because I'm forcing him to. Will you say it?
Well, when
No, Sarah, you say it.
Yeah. When he has all of these feelings, and then you respond like this, how will he feel?
Belittled.
Oh yeah,
I didn't put that before.
Yeah, he'll feel
belittled.
Yeah, he'll feel belittled,
and that I don't see all that he does all day.
And he'll feel belittled and like I don't value him. Is that
and underappreciated
and under appreciated. And then what will he do when he feels belittled and underappreciated?
Sort of make me feel that way.
He'll be sort of attacking.
He'll attack me.
So put that,
he'll criticize.
Yeah, he'll criticize.
He puts me down.
And put me down, yeah.
Yeah.
And put me down. And so then who's forcing him to not understand you and to attack you and to put you down?
I'm doing that.
Yeah. Now, is that easy to see or hard to see?
It's hard to see.
And tell us why it's hard. In what way?
Well, in the moment, it just feels so clear that, that I'm being wronged, right? Or that
Mm-hmm.
I'm not being seen for all my worth, and I just feel so
And that, and he won't want to see my worth,
yeah, won't see my worth.
and he won't want to.
Yeah, no, definitely not.
Won't want
Won't.
to see.
I think that's even more key, is
Yeah.
that right? That he won't want to.
Yeah.
Is your pen running out?
Yeah, my pen ran out. Oh, thanks, Kevin. He won't want to see my worth.
Yeah.
Or he won't want to internalize or consider all that I do for our family.
Yeah.
And
Yeah.
all that
Yeah. Put that down. Yeah. He won't consider or value or appreciate all I do for our family. And now the just a very short teaching point is that this is painful. It probably seems kind of politically incorrect, because I'm asking Sarah to take the 100% of the blame for this problem. So that's David's male chauvinism rearing its ugly head again. But the other side of it is that if you can tolerate this, if you're strong enough to tolerate this, then we can turn the whole thing around and put you in control. But this is why the interpersonal model is so hard, because it's, people go on the road, they do work. Oh, I'm going to show you how to get the love you want and the love you deserve, and you're going to learn this or that trick of the secret of a happy marriage. But in my own life, I mean, I don't see any solution other than looking at my own role too, and it always just shocks me, and it's painful for me, and sometimes it takes me a while to see it too, and then I say, oh God, that's awful. You know what I'm saying?
I do know what you're saying, because this is, this has been going on for a lot of years, and I've been very, very sure that I am right.
I know.
In most of the interactions.
Well, you've got a beautiful attitude. I just, it's awesome. Now let's see how we're doing on time. Let's just take a minute or two and get a little feedback from folks, and then let's go on to step 5, because we want to have some time to show you how to turn this thing around. But I have just so much respect for you right now. I feel so close to you, and I'm just filled with admiration. Right now is how I'm feeling.
Thanks, David.
Yeah.
I know, I want to join on that. I loved you before we began, and now I love you even more.
Aww.
I just feel so proud of you, Sarah, for doing this work.
Thanks, Rhonda.
And I can't wait till we get to the next step.
That makes 2 out of the 3 of us. Just kidding. I'm really excited.
Yes, I'm so happy to find out what a loser I am. Right. Thank you, David. I just love your model. And go home and start sobbing uncontrollably now for another week until I have to come back to your effing class again.
Well, Sarah, I'm cheerleading, but you took a lot of courage to do this, to volunteer to do this work, to be on the podcast, to actually face, David said blame, but I'm going to say responsibility. And, you could have said, no, I'm not going to do this work. I want to focus on me. And
I almost did say that.
You almost did say that.
But you're right.
Yeah.
Well, why don't you see what Kevin thinks, because he can be pretty judgmental.
What do you think, judgmental Kevin?
Yeah, well.
He is a man, after all.
Yeah, well, it's interesting, because I can tell as you were going through and thinking of working through with David, like your part in forcing your husband to treat you in this manner, that you're already looking at what it must be like to be in his shoes in this situation, and having some warm feelings towards him, even as you're noticing what you don't like about your role in it, right?
Right.
So that's just exciting for me to see, and so I'm eager to see what you do next, basically.
Thank you.
So I feel like you're setting yourself up for a lot of success here.
Yeah. Well, it's interesting, if I can comment here, that there's it's even before doing the final step, there's I feel a little liberated.
Oh yeah.
In this idea of appreciating him
Yeah.
again, or
Yeah.
being closer, or
Yeah.
having a warm
Yeah.
relationship in which we communicate well and are loving in the way that
Yeah.
all the reasons that we decided to marry one another
Yeah.
that have been confusing cognitively,
Yeah.
right? And
Yeah.
so even before doing this, it's like, oh yeah, it's not really that fun to be mad or resentful all the time.
Yeah. Yeah.
And I'm interested.
Well, let's
Yeah,
let's
finally.
push on. I wish I had time
Okay,
to
let's
get
push on.
feedback from all of you folks, especially Estelle there. Yeah, I was going to say, let's see what Estelle has to say.
Thanks, Karen. Well, I just want to really appreciate you for doing this and taking like a huge plunge, because I mean, I've only been married for 3 years, but I definitely struggle with feeling like my husband understands, especially what it means to be a therapist and how big of like how I feel like it's like part of like my identity and my calling, and for him not to understand is so hard for me. And I just want to really thank you, because I feel like, you know, you talking about how liberating it is on the other side of dying is like really helpful, and just really feels like you paved the way for like me to do my own work. So I really appreciate that.
And I appreciate your comment. Thanks.
Yeah, you're just giving us a tremendous experience here tonight on so many different levels. Let's push on to step 5. Now, if this is a podcast for our listeners, we're going to use the 5 secrets of effective communication, along with maybe some of the 3 advanced secrets, like changing the focus, positive reframing, stuff like that. But mainly focusing on the 5 secrets: the disarming technique, thought and feeling, empathy, inquiry, I feel statements, and stroking, in no particular order. But how would we use the 5 secrets here to respond more skillfully? If we had time, I'd ask you all to put a 5 secrets response, but because our time is short, I do feel a desire to get from A to Z.
Okay.
We'll just go ahead and do it. So what might we say? What is his first name? Or you can use a fake name if you want.
It's okay.
Yeah. What's his name? Or what name should we use?
We can use the name Mike.
Mike, okay. His actual name is Michael.
Mickey in some circles.
Yeah. So what would we say?
You know, babe.
I'm writing it down, by the way. You know, babe. Yep.
I would say that.
Yeah, that's good. I like it.
Your question makes a lot of sense. And, you know, you're right. There is some, you know, it's unclear to you how my days go, you know, as my schedule varies quite a bit. So I could see why you would ask that. And, you know, it sounds like you would like to know more about how I spend the hours of my day. And, you know, I imagine that at times you feel overwhelmed and worried and anxious and frustrated, being the primary breadwinner for our family, and knowing that as far as generating income, that, you know, the primary responsibility is on your shoulders, and with me working part-time, I mean, that must be frustrating sometimes for you, that I can't sort of meet you and make more money and put all that you do into keeping our family together. And I just want you to know how grateful I am. I know you work so hard every day, all day, and even at night. Early in the morning, even on weekends, and you're always thinking about us. Our girls are so important to both of us, and I know how much you treasure our family, and it scares you, this idea that you might not be able to keep up. And I just want you to know, I think you're so awesome, and your business has really taken off, and I'm so proud of you, and just really treasure you for all that you give us. I'm wondering if you feel like I'm understanding you right now.
Okay, what grade do you give yourself?
Maybe a B. B
Mhm.
plus. Felt a little long.
Mhm. There,
First
what,
time though, you know.
what you did
Doing this
for
with
what
him.
you did was really beautifully
Mm.
done, but you missed one of the 5 secrets of effective communication, and without which you're see. Why don't men understand women's feelings? Do we see the answer now?
Mm-hmm.
And what's the answer, Rhonda?
You didn't say an I feel statement.
I thought I didn't.
I wrote down everything
I
you
said I
did
feel
too.
grateful.
Well, yeah. Well, which of these feelings did you share? There's 20 feelings. You did a lot of stroking there.
Yeah.
You remember you did the same thing,
Yeah,
Kevin,
yeah.
in the session we did a
Interesting.
couple months ago.
I did, and it's just reminding me of
Isn't it
what you
mind-blowing?
of what you say about relationship and intimacy
Yeah.
is being illustrated here, because you said a lot of nice things about him, right? But this
And you
isn't,
said them beautifully.
and you said them
Thanks.
really beautifully. But this was not a nice, beautiful moment for you, right?
Mhm.
It was a painful, hurtful
Mhm.
moment.
Mm-hmm.
And so remember that intimacy isn't everybody getting along with each other really
Mhm.
well, or even feeling good all the time.
Mm-hmm.
But it's being able to talk about when you are feeling hurt
Mm-hmm.
or angry
Yeah.
in a respectful way. And so if you had shared some of those negative feelings that you were feeling, then it probably would have been an A
Or an A plus, yeah,
right?
an A plus.
Yeah.
But that's scary, right?
Yeah, but can
Yeah.
you do that now?
Okay.
Do the piece you missed there, and
Yeah.
and Mike, I also want you to know that I'm feeling.
Mm-hmm. So I also want you to know that when you ask that question, I feel worthless at times, and inadequate in comparison to you and all that you're able to do for us each day.
That's like 10% of the way.
Okay.
Mhm.
And
What are some other feelings that I have?
and
I-
when you
And I sometimes feel HURT.
and I sometimes feel really hurt, and
even
unappreciated, and
yeah,
even angry. I mean, I definitely feel angry when I feel like unappreciated, because I know that I'm always doing something for others, and mostly our family, and it would mean so much to me to know that of all people, you saw my worth.
I give that an A plus.
Yeah, that's like the.
Isn't that what fantastic?
Mm-hmm.
Are you tearful?
Yeah, a little bit, because I get so many. I get so much positive feedback. I have so many wonderful people in my life, and
Us and Rhonda.
you and Rhonda and Kevin and everybody here. I have tons of friends and a lot of loving family members, and really have often been appreciated and given
Yeah.
positive feedback. And for some reason, so I want it the most from him, because he's the most important person to me.
Yeah.
With my children, of course.
Well, let me say this: you're way closer than other people. You were as close when you had your session, Kevin, with the exact same issue with your mom and your siblings and stuff like that, and then you went out and hit it out of the park and followed through. And I would say it's the same. Most people can't get it as fast as what you got it tonight for a myriad of reasons. And now I'd say your homework would be to have this conversation with him, and then to send an email to the group. They either mission accomplished or I stubbornly refused.
How much time do I have?
Well, I was thinking 24 hours, but it could be 48 hours. I don't want to be putting you under additional pressure. You tell us what would make sense if you're the supervisor of the therapy.
Well, I would like to, I feel motivated and ready. I'm just thinking about by the time I get back to Oakland, might be asleep.
Yeah, exactly.
And it might not be the best time.
Do you have a police whistle?
And the morning is hectic.
You
But
throw cold water and say, hey, guy, I need to talk. I learned something awesome in group tonight.
tomorrow I have to take my daughter to ballet. But then
Sure.
maybe by
Couple days.
would Thursday be okay?
Yeah, sure.
All right.
Yeah, it'd be great. Now let's do it one more time here. Oh,
Okay.
we've got plenty of time here. We're moving fast. Could I talk to you for a minute, sweetheart?
Yeah, sure.
The fact is you're only working part-time, and I don't even know what you do all day.
Yeah, I mean that's it's a good question. It makes sense to me why you might ask that, especially because you're so invested in providing for our family, and you're working so hard. You don't actually get the chance to see what I'm doing all day, which must be frustrating on some levels to not know that, not have that clarity. I also imagine that that you worry, and that you feel burdened at times by all that you have to keep together for us, to keep this roof over our head and do all the things that our family likes to do and keep the girls in their good schools. And that's a lot of pressure for you, I bet. And I imagine sometimes you don't feel appreciated by me, and maybe even hurt and angry at me when I'm always talking about all the things that I have to manage, when in fact you also have so much pressure and so much that you're dealing with and managing. I would like to let you know that when you ask me the question in that manner, I also feel hurt and unappreciated and worried that you don't see my value and the worth, and what I do for us as well. But I also think it's important to let you know how grateful and appreciative I truly am of you, and how much I love you. And I'm just wondering if you feel like I'm understanding where you're coming from.
What grade do you give yourself on that?
What
did you give it?
I would have said it was an A+.
Yeah, what'd you say?
Totally A+.
Yeah, that was awesome.
Did I get them all?
Yeah, you got
You
it
did.
all.
I got them all.
And it was really well
It's a
done.
little different.
The only way to go from A+ to knocking out of the park at the A at the end, just to modify slightly the inquiry.
Right.
And did I get it? Or maybe to say, Tim, can you tell me more what it's been like for you?
For you, right.
Have you been
Yeah.
feeling
Yeah.
alone and unappreciated and kind of hurt the same way I've been feeling?
Yeah, I can see I sort of closed it down.
Yeah.
And I like your approach, sort
Yeah,
of opens it up.
Just open it up. And you might even say, although this is hard for me because I do love you so much, and maybe hard for you too. I'm thinking that this can bring us closer together, like in the old days,
Mm-hmm.
because I want my mic back.
Yeah, right.
How's that?
That was great.
Yeah. But the listeners, I want to say to you that you should not think that the 5 secrets are easy, because it's only going to be one person 100 that can learn this as fast as you have tonight, and you've been doing some work on it already. But this is what needs to be done, and then this can cause the solution to this marital conflict that's been going on one way or the other for years. This can cause.
Mm-hmm.
You can solve a relationship problem generally in 60 to 90 seconds
Mm-hmm.
if you do this. But you
Right.
know, it's the oddest thing. Nobody wants to do it.
Mm-hmm.
We seem to want to do battle with the people we think we love, and but I'm just so inspired by what you're doing. But why don't we see what other people think here, and we can hand this round. And we apologize for having you folks out of the loop due to not having enough microphones and not enough time. But we'd love to hear what you think now. Why don't we just start with Estelle? And
I took copious notes because everything you said was like gold.
Thank you. Did you mean me or David?
I mean you, Sarah.
I thought you meant me.
I took reasonably extensive notes on what David said, but not copious. I was typing like a fiend over here.
Copious.
It was beautiful, though, wasn't it?
It was so beautiful.
Aw.
Yeah, Conjugate's really hard for me. So I just do feel like you did it beautifully, and I want to like get what you said. Like all of it was so true. It rang so true, but it came out so naturally. So I want to aspire to do that too.
Thank you. That's very meaningful.
And Esther?
Yeah, I think this whole thing was set up in advance, as usual. The way David zeroes in on when I was thinking, oh, God, where do we go from here? You know, is there something wrong with her patience that's getting her goat or something like that? And somehow David gets right at it. And then obviously by the time you got to your final 5 secrets, you'd practice that way in advance. And because it was really beautiful and thematic and in order. So you can't fool me.
Thank you, Esther. That was so awesome.
Yeah.
First of all, I wanted to say I have such a great deal of respect and reverence for you for stepping forward today and being so courageous to kind of show this vulnerable side of you and actually challenge this. This takes a lot of courage. And I really felt like a shift as soon as you inserted that last piece in there that I felt like it was this kind of like the construction of the bridge of intimacy between you and your husband there. And it was so beautifully done and so genuine and so kind of real and raw. And so I felt like it was like this complete bow. And I hope you're ready to go. So you've inspired me.
Thank you, Rose.
Wonderful.
Okay. I am so deeply touched and inspired. I really appreciate you volunteering to do this, and I'm a little surprised by the degree by which I identify in your journey and your experience, and being a woman therapist in private practice and all the work that comes with it. That I don't think I really realized how much it involves until I find myself doing it. And the beauty of being a therapist and the beauty of being a therapist doing TEAM-CBT is that you get to do your own journey, and then your work is so much more powerful and authentic. And I think that's going to make you such a better therapist, and that your clients are so fortunate to have you.
Thank you.
You probably have to hold it right at your mouth because these are more sensitive than the handhelds.
Like this?
Because we've got them, you know.
Yeah, I'm filled with so much kind of admiration and gratitude towards you. I think it's so incredibly brave to volunteer to do this at all, and on top of it to be recorded and talk about such a vulnerable issue that as a therapist would be especially vulnerable and scary to expose to us. So thank you. I'm so inspired. I hope that I could have your courage at some point. And thank you to David and Rhonda and Kevin. Even though I'm very familiar with Relationship Journal, I still learned so much. So it's just amazing to have these personal work classes where like all the techniques kind of like merge into this beautiful whole. It's like amazing. So thank you so much, and
thank you.
Thank all of you.
Ravid?
I just want to say thank you very much. I'm so happy to be here, to be part of this group, and to hear you today. I'm so happy for you. Thank you.
Now let's just see how you're feeling just at this moment.
Okay.
How sad are you feeling right now? How unhappy?
I don't feel sad. I'd say 0.
0. How anxious, panicky, nervous are you feeling?
At this moment, 0.
0. How How ashamed are you feeling? That first one from 80 to 0, that one from 90 to 0. Now, their shame was 90. How ashamed are you feeling?
0.
0. How incompetent and inadequate and defective are you feeling? That was 90.
Yeah, 0.
0. How alone are you feeling? That was 70.
0.
0. How self-conscious are you feeling? That was 90.
I'll just say 5 because of the recording.
Yeah.
But slower.
Did I tell you it was a live CNN feed also? Yeah. Anderson, I promised you a good one, and I gave you a good one. How discouraged are you feeling? That was
0.
0. How frustrated, stuck, defeated? That was 100.
0.
0. How irritated and upset? That was 80.
0.
0. And what would you say was the healing dimension? Because we didn't actually deal with your negative thoughts.
Well, I mean, I do have some question, right, of how, I think that I need a little time to see if a connection is occurring in this realm in terms of
it'll be fun to see
how I sit through my sessions upcoming once I've also done the work.
You can send us an email.
Okay.
Say relationship with husband is wonderful. Freaked out with my patients. Practice has disintegrated.
Thank you,
but all is well.
But thank you, Dr. Burns. We've trotted off into the sunset.
Yeah. Well, we'll see. You might not. When Masha did something like this in group, her anxiety just disappeared.
Yeah.
But we have tons of techniques if you need more help with the anxiety.
Right. So, and I have to carry through with my part of the bargain.
Oh, yes, right.
And maybe not just the one time, right? I have to
do
this ongoing.
Yeah.
Which I'm excited about finally to do.
Yeah.
And so, I feel more hopeful and we'll see. And if I continue to struggle with these types of thoughts, I know who to call.
Yeah, that's right. That's right.
I'll drive to the Marietta studio.
I give a money back guarantee
for this free work,
and I give unlimited lifetime tune-ups.
Okay.
You have a lifetime guarantee whenever you work with me.
Okay. Thank you.
So you have unlimited free tune-ups anytime you need them.
Okay.
But it was just a terrific experience working with you, and I guess there are probably dozens of teaching points here, but just the one big one is that we didn't touch on any of the anxiety techniques. I've got I've written a couple of books on anxiety at least, and there's at least 30 to 50 powerful anti-anxiety techniques, but just one of them is the hidden emotion technique. And when it's going on, it can have phenomenal healing effects and also explain the timing of anxiety. And it's important to know about because most cognitive and behavioral therapists not only don't know about it, but they would poo-poo it as being some silly psychoanalytic thing. And it is a kind of simplistic psychoanalytic technique, but it's behind your anxiety. There's human feelings about real things going on in your life. Anxiety doesn't just come mysteriously out of the blue, and I know because I've had so much anxiety myself, and I know this hidden emotion model, and it is, again, this isn't a cure-all for all anxiety, but it's a very powerful, prominent tool that you cannot effectively treat anxiety without it. And this might give you more dimensions, or maybe you already use it in your work, but it's a cool technique to know about. But you have to have a little faith in doing it because most anxious patients are not as open and quick as you are in helping the therapist come up, well, this is the resentment I'm feeling, this is what's going on in my life. Most of them, including me, when I get anxious, can't actually see it, have a kind of blindness, and you have to work with them a little bit to bring it to conscious awareness, and sometimes it can take 2, 3, 4, 5 sessions before it suddenly dawns on them what the hidden emotion is.
So you started asking Sarah questions about her life outside of her work that led to the hidden emotion coming forward.
Yes, but I had to have that hypothesis in my mind and put a few things together. Here's another overworked mom. And I'm saying, how would I feel with all those things? Because I've had a lot of stuff going on. I've been under a lot of pressure lately, too. It's self-imposed. and I can turn anything off anytime I want. But I've been feeling the same thing. I found my own solution yesterday, actually.
Oh, congratulations.
Thank you.
That's
It was very
wonderful.
liberating. It was like I'm on top of the world, really.
Oh, good.
But
We'll be there together.
yeah, that's right. Maybe we're made for each other, you know.
MFEO.
Hope it doesn't work out with my
Yeah, that's
Oh, good. I know where to run. I said I would drive to the Murrieta studio.
yeah. But anyway, that's just kind of a good teaching point to keep in mind, that you want to understand the human being and just not applying techniques to some symptoms or some diagnosis or something like that. We're treating humans. Any other closing comments or anything?
I was just wondering, what if you could never find a hidden emotion?
Well, often you can't. I mean, I think it's only there maybe 75% of the time. You know, sometimes a phobia is just a phobia, so it's not always there. But I've had patients. In the early days, it took me a long time to figure it out, and now I can generally figure it out. I can sniff it out faster now because I've had so many thousands of hours treating anxious patients. But it's just one technique out of 100, and if it doesn't pay off, it doesn't make any difference because we've got so many other powerful anti-anxiety techniques.
I've tried the other ones, and I'm pretty sure there's some hidden emotion, but he doesn't know what it is. I mean,
With a patient, so we could consult on another occasion with how to do it with your patients. But all I really do is, when I'm working with an anxious patient, I just start telling them, like, you're suppressing something, and I'm going to have to insist you bring it to conscious awareness right now. That's about all I do. I just say, I think there's something going on that you're not telling me, something that's bugging you, and we'll address all your panic attacks or your phobias or whatever. But I'm pretty sure there, and I don't know what it is, but your anxiety is probably a symbolic expression of it.
Right.
Do you see? And your anxiety is saying, I'm about to crack up here. I can't take this. Do you see?
Right.
So your anxiety is telling us what the hidden emotion is.
Yeah.
If you listen to the anxiety symbolically, then the patient's already telling you, but the patient has to tell you in disguised form, because I'm not supposed to feel angry toward my husband. I'm not supposed to have resentful feelings. I'm supposed to be a good wifey and be able to do all of these
handle it all the time.
Yeah.
It's another example of listening to the music underneath what the patient is saying.
Oh, I love what you're saying. That's right. And that's such an important skill to develop. And it's not always easy. It takes time. It took me a long time. You know, and I'm elderly now, some people say. But I'm just starting to get it. But once you get it, it's just so wonderful to have this skill of understanding how people are really feeling. But I had one patient, I'll just answer your question, Esther, that I never could figure out the hidden emotion thing. But I treat him with other stuff, and he did pretty well. He wasn't a real fast responder, but he had, bipolar and a lot of anxiety and stuff. But I could never make the hidden emotion model work. And I always thought there must be some hidden emotion. And then I ran into him on the street about 5 years later after he terminated therapy. And when I saw him, it suddenly occurred to me what it was. And I said, why didn't I see this, 5 years ago? But when you see it, it's obvious. Like, this is obvious, right? And yet, if you went to a therapist who didn't know the hidden emotion model, you'd just be spinning around with these negative thoughts and trying to crush the negative thoughts and not getting anywhere.
I want to add one interesting thing.
Yeah.
When I was filling out my mood log and she was starting to talk about recording the
Yeah.
session, I said to myself, I'm going to do this in a way and not talk about my relationship.
Oh, yeah, right. Yeah, exactly.
And you notice I didn't put any
there was
thoughts
nothing about it. Yeah, but I had a
as
hint.
soon-
Here's another teaching point.
I think you started by saying, how old are you?
Yeah.
I think that was his first in, and I was like, oh God, we're going hidden emotion.
Yeah. But another tip.
And then I tried to resist.
If you
Sorry.
look, what was the tip that we had in the initial testing?
the
Oh, right.
relationship scale.
Yeah,
Yeah.
the score was poor.
Right.
But again, most therapists wouldn't attend to that.
Mhm.
They wouldn't notice. But the reason we do the testing is to get information that will help you in the session. Well, we're going to stop this, but you gave us just a wonderful, wonderful
Thank you.
teaching evening. Thank you.
Thank you very much.
Yeah, thank you. Woo! Woo!
Yeah.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this episode under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. The theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donsel. I am your host, Rhonda Borowski. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.